let me just go to the pool issue because it's another change for the insurance industry. In the past, you had a block of business that when you started having risk accumulate, they could open a new block of business and attract the healthy folks out to get a better price. Cindy's statement that they have to all be in one pool makes this be a tougher business for the industry than a fair business for the consumer.
Okay, we have Ferguson, Urban, Chesterfield, Nichols. But real quick, and this is an honest question, I didn't read the article, but I just saw a headline earlier today about California's plan coming in. I thought I saw, if I remember correctly, $4,500 was maybe annual cost. Did you see what I'm referencing? Okay, never mind. It seemed that it was certainly lower than I think they had projected, and certainly lower than CBO's projection.
Those are going to be lower than what we've been seeing. Yes.
Yeah, that's kind of what I was.
Mr. Chairman, I was at a meeting that included some insurance analysts and executives over the last couple of days, and they said California and a couple other states are seeing much lower prices than they expected.
What was Optimus's, and that was it like 5,500?
Private option?
Yes.
We'd have to look if I can find it.
Yeah. Well, if you want to look for that, we'll go on. But I'm curious about what number, what we were projected to be, where we were. Representative Ferguson, you're recognized.
I was just wondering, it seemed that one of the best places to enroll uncompensated care patients would be when they show up in the emergency room. But if there are no guides in hospitals, how will they be enrolled?
The hospital can have workers that can enroll and be trained to do that. And there's nothing that would keep a guide from going to the emergency room or for the emergency room to connect with a guide. We will publicize who's guides, who's available in your community, and one thing they will need to do is connect with their hospitals. Perfect place for enrollment.
Representative Ferguson, I want to back out just for a second. You don't have to have a guide to enroll and get insurance. In fact, I think most middle to upper middle income folks are going to be able to navigate the choice process without a guide. That's largely why some of these companies, to represent Hammer and Meek's comments, are those that serve a much lower, less literate population, and there's not a good fit with healthcare providers. To the question that I think Senator Bisping asked earlier, we have advised both the Medical Society and Hospital Association, look back over your last 3 years' experience for those who were uncompensated users of your services and do outreach to make sure they're aware there's a new mechanism. So I think the guides would have a lot of focus on, but there are multiple avenues into the insured opportunity that we're offering. And so I think independently, through a guide, through an organization, hospital, physician's clinic, church, there are lots of different organizations that